viewers that are getting on the internet, they're getting on social media, and they're confused about a lot of things. So we're going to talk about it. We're going to talk about it with some real international experts in plastic surgery. We got Dr. Jason Posner from Boca Raton, Dr. Mark Epstein from Long Island, New York, and Dr. G. Barty from Charlotte, North Carolina. Boys, great to have you. You know, we've got a great no spin for you today. This is actually a story that was on Botched, and this lady went to the Dominican Republic, and then they said her breast implants fell out of her chest, which I don't think that's exactly what happened, but there's probably a lot of good teaching educational points to be gleaned from this story, so lead us off.
So I got to say, if you really want to watch the sensationalist discussion of this particular problem, watch the Botched clip. If you want to listen to four plastic surgeons discuss a potential complication of a breast surgery, then listen to us. All right? So this is a lady that went overseas for surgery to the Dominican Republic. It looks like she had an infection, okay? And the implant extruded and had to be removed. Now, I've been in practice for over 20 years, and you know what? Pretty much every other year I see an extrusion that an implant needs to come out. It's nothing that surprises me. This one looked like a pretty big hole. The patient looked like she was certainly pretty not smart, I'll call it that way, for not going to the doctor sooner. Because if you got a big hole in your chest and your implant's popping out, I mean, I probably would have gone to the doctor a lot sooner than when she got there, and potentially have been salvaged. If we saw some impending issues with the breast, we would have treated the patient with antibiotics or perhaps taken her back to the OR sooner and closed her. But certainly I wouldn't let it go to the extent where you got a big open hole where you could see a big implant in.
So Mark, this is first of all, this is not something that's super common at all, but infection after breast implant surgery, what do you tell your patients? How common is it?
I tell them that the incidence of infection, at least in our practices, is under 1%. It does happen. A lot of times you can salvage them. I've had a couple that I did salvage successfully, and they're doing very well. But extrusion, I think, there's more to it than just an infection. I think this is probably a case where I haven't seen this particular one from Botched, but I did have an extrusion case that came into my office. It was a woman actually in my school district who had surgery by a colleague in town, and he took out her 560cc implants and put 800s in, and this is a woman who was probably about 130 pounds. And she had a chronic infection. He was treating with Cipro. And when she came to see me, there was cellulitis, and I could see the implant. So I just pulled both of them out, and I told her I'm not putting 800s back when the infection's cleared. And I put in about 4 something, and then she wanted me to go bigger, and I said no. And so she went elsewhere.
I think, like Jason said, when these things come on television, they're definitely sensationalized. And but it's real. It's not just medical tourism cases that this happens to. I've taken care of a patient who showed up from another provider with an implant hanging out, who was a big-time active smoker, had no soft tissue in place, and had these huge implants, and she kept, having infections. So I think it's a real issue. Fortunately, I think all of us in the room typically haven't had our patients doing it because we see patients in close follow-up. So I think my words of wisdom to patients are like, when you're having any inclination of any issue, you should be seen by your provider. And it's normal for your provider to see you post-operative day, 1 to 3, and then in a week, and then in 2 weeks, and then in a month, and then a couple months. So these things are caught. So it's abnormal for these things to not be caught unless you're potentially being mismanaged usually, or you're not going to your follow-ups. So I think a lot of problems can be avoided either by not having the procedure or appropriately managing small issues that could be potentially treated to avoid a big issue.
I think these are all very important points that were brought up, and the media has a certain responsibility to its viewers, and especially when you have board-certified plastic surgeons in charge of the story, to sensationalize it and make people think that implants just fall out of your chest, I think is damaging to the public. I think that a message should have been brought forth that if there's close follow-up, these kind of things generally don't happen, and that patients should be encouraged to call their providers should anything not look right at the earliest possible time. Those messages are really responsible journalism would be about. This is just sensationalism, and it bothers me that these messages are not brought forth.
Yeah, those points are good, but you can go, there's places internationally that you can go, and there's some excellent surgeons that can do a really good job. But the thing is, it is tough. If you're having a surgical procedure, it's tough if you go somewhere, even if it's a reputable place, you don't have regular follow-up when you get back home. And like you just said, we're oftentimes seeing these patients back multiple times to check on them and make sure things are right. And if there's a little problem, sometimes it can be taken care of just with a quick visit. But if it waits and gets put off and doesn't get evaluated, then it can turn into a big problem.
A small suture abscess can turn into a raging infection if it's not dealt with. Little stuff.
And you're right, and I think all of us have taken care of patients from far away and out of town, and we have a system in place to evaluate them. We have them send pictures. We still do virtual-based follow-up with all of them, and so I think you make a great point, Bill. Like, you at least have to do that. You have to check in. If there's something wrong, they can send you a picture. You see a little redness or something, you're like, this needs to be evaluated, or maybe I need to put you on an antibiotic to clear whatever's going on there. But I think follow-up is paramount.
Yeah.
I think the new phones and everything, obviously we're worried about HIPAA problems and things like that, but I think we're getting our patients way better follow-up than we did in years past with the advent of smartphones and being able to just email me a photo or something like that. We get right on it, whereas before we said, well, come back in a day or two, I can't get there. It's way better for the patients.
No question. We use that all the time.
All right, well, full throttle, boys. There's some great points, and if you want to see more of this, you can see it on the plasticsurgerychannel.com.